All right, welcome back. When you're hurting, surgery can be a scary option, but Dr. Kenneth Bramlett is an orthopedic surgeon at Bramlett Orthopedics, and he joins us now to tell us how you can avoid needing to be on his operating table. We were talking about some of the different issues people have, rotator cuff issues, knee issues. Before they get to surgery, what are some things they can do to kind of help manage pain and I guess maybe self-repair, if you will?
Well, if you take someone with a shoulder, I mean, it's very common that, people develop symptoms of shoulder pain, can't sleep at night, take off a shirt, reach your seat belt, things of that nature. But you may be doing an exercise program at their gym or with their trainer, or the way they've got their house set up is just they're aggravating on a regular basis. So there's things to do to avoid that. It's very common that people have hurt themselves and they let these problems malinger, and an early impingement syndrome, which is, for example, a bone spur on your shoulder, if it becomes a chronic process more than 2 or 3 months, then it's probably not just bursitis. So the issue is to fix things before they become too disastrous, if you will, requiring a major operation as opposed to something that's maybe arthroscopic or either an injection, be it a cortisone injection, or just a simple process of therapy can sometimes turn this around.
And you mentioned if you're feeling those pains, maybe rearrange some things in your house, especially if it's a shoulder thing that you don't have to reach as high or things have to be as heavy for you.
That's exactly right.
Just little things you can do.
Your younger age group is involved in a heavy gun building program, generally speaking. So they have a problem maybe overdoing it, particularly way out flies in a gym where they let arms away go outside of it on a physiological norm, or they're involved in a very progressive, engaging, CrossFit situation or something of that nature. And once they get hurt, they don't know how to back it down. So backing it down a little bit, going maybe half their weight, using an anti-inflammatory, which is commonly Tylenol and Advil or something like that, combined. Ice is very helpful in that regard. But you want to avoid a rotator cuff major tear, because once you tear it, then you have to go more engaged with the fix. And they're easy to fix, because if you have chronic pain, can't sleep, put on a coat, reach your seat belt, those are the prodrome symptoms of maybe impingement, which is predrome to rotator cuff tear.
So if anyone at home is listening to this and they think some of these symptoms might be something that they're dealing with, if they want to, I guess, talk to you guys or see what they can do to avoid surgery, who should they call or what number should they call? Is there a website they can visit to get these things answered?
We have a website, but our number is just simple, office 783-5900. But, there are lots of people treat this condition, but if it's going on and not improving, you want to intervene before it becomes much more difficult to fix. There's no question about that. Now, in management of a controlled exercise program is probably the first step.
All right. Well, thank you so much, Doc. We appreciate your